Robin Flynn sitting in for Elias Makos. Just got a text to 514-800 from someone in Repentigny about a power outage out there. I just checked. Hydro-Quebec says that there was an equipment failure, so you've been without power since 7:30 this morning. A crew is on the way. Originally, they said power would be back by 10:30. It's presently 10:50, so obviously they haven't managed to keep that promise, but they have no information about an updated restoration time. So I'll keep an eye on that for you. You can text us at 514-800 if you're in Repentigny and let us know if and when the power comes back. Now, a few weeks ago, we found out that the ER at Lachine Hospital would be closing for most of the day, only being open for a few hours. And that was a move that doctors expressed extreme concern at. Obviously. Now the doctors at the Lachine Hospital have come together to offer an annual bonus of $15,000 for 2 years to the first 3 respiratory therapists who are willing to come work at their establishment. Now, this is obviously an exceptional measure. So why is this happening and where is this money coming from? Dr. Paul Saba is a Montreal family doctor, president of the Council of Physicians, and he joins us now. Hi, Dr. Saba.
Yes, good morning, Robin.
Good morning. Now, how did you guys come to this decision? And perhaps more importantly, where's this money coming from?
Well, it's coming from the doctors. We have a common fund. Also, we spoke informally to different doctors. We do chats. The executive got together and passed this unanimously. We have an executive that represents all of the doctors, and it was unanimous. And we just came up with that number because for example, the MUHC is paying an incentive of 14% for the same patients that were treated at our center. It's a ventilated patients who are actually kept in a long-term facility, which is connected to the hospital. So you're literally talking only a few feet. The patients from one could be transferred over to the next building. And because it's called a long-term facility, same patients, they're on ventilators, and these were the same patients treated at the chest hospital a number of years ago. And the inhalation therapists and nurses got a 14% differential. That's as of today, 14 plus 4 for the COVID, so it's 18%. And the answers from the MUHC and the ministry is we don't discriminate. These are collective conventions. And ministerial, we can only function by ministerial degree, and anyway, all this stuff, combobble, I call it. But all they have to do is, it would take literally 5 minutes for somebody in the government to say, we consider these same patients that are being kept in a pavilion, we consider these as hospitalized patients or intensive care, and we will give the same difference. So over the last year, we've lost 4 of our respiratory who went downtown because they said, we've been asking for years for this differential and nobody's given it to us. And as I spoke last week to the administration, they still haven't given that differential. So we say it's discriminatory, and we found this out through inside sources. We have to we have to do our own investigation because not all the information is forthcoming. And I even spoke to some of the people who are working, won't give names because they're afraid of reprisals. And even me, I've been told in so many uncertain terms to be careful of what I say and this and that. I say what the best thing to say is the truth and not be afraid of that. And so I'm just laying out the facts, and they haven't been able to contravene. Others say that we give, everything's the same between establishments and between this and that. Yeah, but it's not the same because these are the same patients that were at the chest hospital, transferred to a pavilion, and the people did not get the differential. So 14, and it works out to be for an entry-level respiratory tech somewhere around $7,000 or $8,000, just kind of grosso modo. So we figured, after speaking to various people, that for them to come back for the same amount was not interesting, so we doubled up on it. And so we came up with the $15,000. By the way, these incentives are, as far as I know, I've been told, are not available to respiratory techs, only to nurses. So we came up with this differential for our res techs because that's what we're told would suddenly cause the closure of our emergency room. And by the way, we had the same number of staff 2 months before as we did the day that they closed it. So we're just questioning, what is all this rush? Why? We don't understand. So you know what? They can't fix it, for whatever reasons, ministerial degrees, ministerial collective agreements with the unions, blah, blah, blah. So we'll take it in our hands and we will provide the incentives to bring the inhalation therapists to our hospital. So some want to transfer back from the MUHC. Fine. We don't want to, they took from the Lachine to give to the downtown. Our intention is not to do the same, but if it happens, it happens. It's a free country. At the same time, we're hoping to attract retired inhalation therapists. And maybe I even got, recently I got an email from BC. So, about the situation, somebody who's willing to help us in that situation. So we're working from every angle. Hopefully, human resources, the MUHC is capable of doing it. So far, they've had trouble. So we're just trying to give a lending hand. Obviously, we sent letters to the ministry and said, please help us, give us the same incentives. Still, nobody's able to write that one line that they need or two lines or whatever it takes. We asked the Premier to do a ministerial decree to keep our emergency room open. He's unable to do it for some reason. Can't, won't, shouldn't, don't understand. Because this is the only Francophone hospital in the West Island. We're part of the MUHC, which we're proud of being, by the way. I'm a graduate of McGill. I'm very proud of my association with the McGill University Health Center. But I'm also proud of working in the only Francophone hospital on the West Island, which was guaranteed by resolution of the National Assembly, which Mr. Legault's, the CAC party was part of, signatory, which used to be called the ADQ, back in June 7, 2007, to guarantee all the services to continue forever. And this is the first time that they've actually closed an emergency room since 1913. So with Mr. Legault and his party are proud of doing that. Fine, that's up to them to put that on their a list on their resume. But we're not proud, and we're not going to let it happen because even though they've closed it, we're going to do everything to get it back and running, and we're going to take all the measures. My dad, who passed away, he was a businessman, had a clothing business. He says, Paul, you got to do what you got to do. And when things were hard in his business, he would pack up clothes. He was a clothing salesman. He would go to the garages, sell clothing to warm up the garages during the cold winter months. He kept our family going. He was well respected in the community. Prices were very fair. People couldn't afford to. He would give things away. So this part of I think my heritage, that it's a can-do attitude and not wait for, administrators or people who are tied in with the rules and regulations to allow an emergency room to close. And by the way, Lachine is the 17th best hospital in Canada. It's always been in the top 20 for the number of years in Newsweek's magazine, despite limited resources. And we just hope the MUHC values us as much as we value them. And the government values us. I have high respect for government. I'm just trying to help the government if they're tied by their administrative rules and governmental rules. We'll say, fine, we'll make it work. And that's what the doctors are doing.
Well, it's an interesting idea, an interesting initiative. I wish we had more time, Dr. Saba, but we're up against the clock. Very, very quickly, I have like 10 seconds left here. Yes. Have you heard from the government about this? I would think the government would be kind of embarrassed to find out that, you guys are dipping into your own pockets to make this happen.
The only thing we've seen in the newspapers, I haven't heard from them directly. They haven't contacted. They've received a letter. As they say, we only can manage things. We give the same to everybody, and it's ministerial degree, and we can't go against collective agreements and a whole bunch of things like that. So, but they managed to run things by ministerial decree. Why don't they rather than shut things down, close businesses, curfews and all this, open up a hospital? They can open up bars, open up a hospital.
That's a really good point. Dr. Paul Saba, Montreal family doctor, president of the Council of Physicians. Thank you so much for your time. I really appreciate it.
Thank you, Robin.